This is video history from the J. Bay Jacobs Library for the History of Obstetrics and Gynecology in America. Sunny May morning in the year 1995. We're in San Francisco with Dr. George W. Morley. George, thank you for joining me this morning.
Thank you for inviting me.
There's no way, I guess, to start this out, you being the physician with whom I've probably worked the longest of anyone within the specialty of obstetrics and gynecology, of saying that it's been said that if you were to bleed, it would be maize and blue. What year did you first go to Ann Arbor, Michigan?
I went to Ann Arbor in 1941 as an undergraduate student. And you're right, we have known each other for a very long time.
In 1941, I guess, as I would calculate it, is even more than 50 years ago. And so you've been a long time within the...
And I've been there all the time, except for the 2 years in the Army. So it's been over 50 years.
When were you in the service?
I was in the service 1954 to 56. I was stationed over in Europe with the Army Medical Corps.
So that you actually graduated then, undergraduate from University of Michigan. What year?
I graduated in 44, and then I spent a year in research, medical research. And then in 1945, entered the medical school curriculum and graduated medical school in 1949.
And of course, I remember personally that you had began your residency in 1949. What was it that led you into obstetrics and gynecology?
Well, my father was a general practitioner, and I stood in awe of him. And I think he taught me a lot about the art of medicine, and he did a lot of obstetrics, so that I had that kind of feeling.
He was in Toledo?
He was in Toledo, Ohio. Born and raised there. I was. And then when I got into my training program, I actually had my first year, my internship year was under Dr. Frederick Vanessa Collar, who was the chief of surgery there. So I had a one-year internship under Dr. Collar. And during that time, I was with Dr. Miller, Dr. Norman F. Miller, who was the chairman of Obstetrics and Gynecology, and I had a great month on his service. He convinced me that I would like very much to do GYN surgery. And so...
he was right, wasn't he?
And so then I did get accepted in obstetrics and gynecology and spent the next 4 years, which you well know about, and under his direction.
I remember you well teaching me my first surgical procedure, which was infant circumcision.
I figured that was coming.
And I knew how to do those better than almost anybody, having learned it from you.
Aren't you nice? Well, I had a good surgical career.
Now, when you came back from the service, you joined the full-time faculty at Ann Arbor.
Yes. And Dr. Miller asked me to come back, so I was in practice with Dr. Miller and Dr. Evans, Tommy Evans, past president, and myself. And I did a lot of OB, so I lived in all worlds. I have a feeling that I did obstetrics up until I was age 50, and actually delivered almost 4,000 babies. So I did that, and then I was certainly interested in GYN surgery all along, and also in GYN oncology. And we didn't have formal fellowships. I did have a preceptorship, if you will, under Dr. Miller, who was a very great cancer surgeon.
And of course, that then ended up being your career, and you remain.
Yes.
This day, and still doing surgery.
Yeah, as a matter of fact, I am. I've always. Somebody asked me what I do. I say that I'm a gynecologic surgeon for benign and malignant disease. That kind of tells it all. I have a phrase, if you'd like to hear it. And that is because I have liked teaching, and I have liked patient care, and don't be worried by the statement that I wrote my living epitaph. I would like to say it to you because I feel it. But anyway, as somebody said, well, the reason you wrote it is because you didn't want to leave it up to chance, but we'll leave that. My living epitaph goes, I got to treat. and I got to train to treat. What more could one ask for? I think that tells all about my career.
Well, I think before we close, we'll have to hear some more of the famous Morley statements. But let me ask you how you first became involved in the college.
Okay. I came back in 1956. Oh, and actually in 1954, I went to the District 5 meeting in Cincinnati, Ohio. I was a senior resident.
The earliest of the meetings.
Right.
The college was 3 years old.
That's correct. And had a great time. And then I came back in 1956. And then I actually got involved in the Michigan Society of Obstetricians and Gynecologists, which is a well-known society for a state group. And actually was originally called the Detroit Obstetrical, I think, and then became the Michigan Society of Obstetricians and Gynecologists.
My father was once president of it.
I know he was, and actually I succeeded him many years later. Well, then they asked me. I was asked if I would run for vice chairman of the section of Obstetrics and Gynecology in Michigan, and I did. So then I was vice chairman, and then I was section chairman, and then actually, fortunately, became the district vice chairman, District 5. It was at that time we talked about the amalgamation or the joint merging of the societies with the sections.
I remember you being very active in that in Michigan.
I played a big role in that, and as did a lot of others, but I was very pleased because the society was quite small and their meetings weren't attended to. They're attended with great numbers, but the Michigan section has grown. I really think it was the right step to take at the right time. So now it's the Michigan section of Obstetricians and Gynecologists.
What then was the road by which you became president of the college?
Well, then I was approached about running for president-elect, and I felt I actually turned it down for a number of reasons. One is the person who was also was a good friend of mine. I just didn't want to run against him.
What year was this?
That was probably around 85. And but then they said, "What about vice president?" And I did accept that, and I became vice president. Then I followed with president-elect and then president of the college, which has been a great thrill. I have to say, during my presidency here, I went to 7 of the 10 districts. So there's still 10.
There's still 10, yes.
And I would have gone to the other ones, except we had 2 overlap, right? And then I went to those, and I did made a number of comments at commercial meetings, industry, and pharmaceuticals, and I always had a phrase that I like to share. I share it with you, and that is that because they do so much for education, they do so much for research, at the student level, at the resident level, and postgraduate level. So I've always said, don't take grants for granted. And, I feel that way because I think they should shake the hands of those people, we as fellows should, because they do an awful lot in that area.
When you were president, every president has a theme of some sort. Your theme was what?
Well, my theme was, I guess, a hysterectomy. To put it in one word, it was hysterectomy. And patient care. My presidential address was on quality of care, quality of teaching, quality of research. Keith White, my title was quality of care. And Keith White said, George, that's a terribly phrase. Why don't you say quality of caring? And it just rang well. And quality of caring covers it all. It's like an umbrella over all the quality of care, peer review, and art of medicine and all. So I really liked that. And then I was involved in developing a video on the history of hysterectomy. That take a moment.
Yeah, well, of course, that was a key of the opening ceremony of the meeting, to Tell us something about it.
Well, I'm very interested in the history of hysterectomy, and I have to tell you that the video was done by the Biomedical Communications Department at Michigan, but it was sponsored and funded by the American College of Obstetricians and Gynecologists. And so I'd done a lot of work in this area, and in developing it in process, I met a professor of history of medicine at the Uniformed Services School by the name of Dale Smith. And he invited me 2 or 3 days at a time on 3 different occasions. And I spent that time in the Medical Library of Medicine, the National Library of Medicine at Bethesda. So he authenticated all that I had. And it just turned out to be, I'm very proud.
It was a marvelous program, which is in the history library.
It's in the history, that's what I was going to say. It's in the history in the library, and it's available to people who would like to see it. It's about 22 minutes long. It was fun. The other thing I did with hysterectomy, I did establish a task force on hysterectomy, and the basic thing we worked on was indicated surgery, the indications for hysterectomy. Whereas the task force never really, they reported, but it never did formalize anything, but it sort of stimulated people around the country to be talking about the indications, and all the insurance got involved. I think there's some excellent guidelines. And actually, I wrote a supplement to Dan Thompson's, John Rock's book, To Live, the Company of Gynecology, on the indications of hysterectomy. And so that's where my focus was. And on the people there. I love the people at the college.
Well, certainly I think if you'll be remembered for anything, which you'll be remembered for a lot, teaching certainly has to be the thing that everybody thinks of when they think of George Morley. And you have a whole set of aphorisms, some of which I love. And I bet you could tell a few. Let me just begin by perhaps pointing you in that direction by saying this. As you probably know, the story was told about your first leader, Dr. Fred Collar, who was one day testifying in court and asked if he agreed with what was said on page 806 of Christopher's text, and he replied, "Young man, I don't read books, I write them." And
that's great. I actually heard that.
Yeah. But you had the one thing that's always stuck in my mind was in getting a residents directed to do an operation the way you wanted them to do it. And you said,
well, it was kind of interesting. I was in the operating room and taking a while because it takes longer for the residents to do the procedure than myself, but I'm right there so that nothing goes wrong. But I said, "Why did you do it that way?" And he said, "Well, Dr. So-and-so does it that way." Well, here I am standing there teaching him. So I said, with my face flushed and my stomach grinding under my mask, I said, "Either do it my way or watch me do it my way." Well, that has caught on.
Yes, you've been remembered.
It has caught on, and I still hear people quote this all over. But I did have fun. I put a book of sayings together, just a collection of sayings, and some of them, sure.
And I treasure my copy, but go ahead.
Well, I just love putting together. I have over 200 in it. You want to hear just a few of them?
We should.
Well, I'm a frustrated athlete and didn't excel at it. That's why I was frustrated. But I love some of them. And the sayings were to deal with the medicine and teaching, but also with life. And like Willie May said when he was asked, what was your most favorite thing about playing baseball? He said, going to the ballpark. That's sort of the way I feel going to the hospital. Part of my professional career. Arnold Power said, somebody asked him, "Hey, are you lucky to be able to play that well?" And I said, he said, the more I practice, the luckier I get. But the one I really liked was Bobby Jones, which had a great philosophy, and it was playing the ball where it lies. And I think that just says it. And then a couple of professional ones. One of the first ones I had was, give me a fish and I eat for a day. Teach me to fish and I eat for a lifetime. And those are basically what, one other one that comes to mind, and that is the road to success is always under construction. So I had a lot of fun putting it together, and people have enjoyed it.
And how is your golf game?
Sorry you brought that up. I said I like athletics. I don't excel in it. But I like athletics. I like golf. I like the good shots, and you keep playing to hope you get something. And you do. And you keep going back. And the handicap is in 2 figures. The first 2 figures, however.
I presume by this time in Ann Arbor you have a dedicated seat in the football stadium, don't you?
I do.
You do.
And it's, yes, indeed. I love the athletics. I love Michigan. I think you know that. Not for the athletics, but I think we're AAA. We have athletics, we have arts, we have the academics there, and I love the medical center. I do.
In the time that you spent there, George, what would you say is the accomplishment that's really pleased you the most?
Well, actually, 3 things have happened to me in the last 2 years. There's another expression that comes to mind, and that is life is a journey, not a destination. And I've had a great journey, had a great career, and actually just in March of this year, I received the Distinguished Surgeons Award from the Society of Gynecologic Surgeons, which I'm thrilled with. And actually 2 years ago, they named the GYN Cancer Service after me, which I also was thrilled about.
As a matter of fact, I believe there's a large plaque in the halls of the hospital. Are there not yet? They're not.
And it's so great to have it as a living tribute, living focus. And I guess the 2 things in my career that were the peak. One was being president of college, question of my life. And the other was they just have established, the first part of this year, they just established the George W. Morley Professor of Obstetrics and Gynecology at Michigan. I'm both humbled and honored by it.
Is there a incumbent of that chair yet, or are you?
Yes, as a matter of fact. No, I'm Norman F. Miller, the Professor of Gynecology. Actually, we're getting a new gynecologist. Dr. Vicki Baker is going to be the director of gynecologic oncology, and she'll be the first George W. Morley professor.
Excellent.
She's thrilled with it.
George, we first met 45 years ago next month.
Yeah, I know.
I learned a great deal about surgery from you, and a great many people have learned a great deal about surgery from you in our specialty. I couldn't be more delighted to have had the chance to talk to you this morning.
Oh, thank you very much, Warren. You know how I feel about you. I stand in awe of you.